surface for collagen regeneration.
Good afternoon all. I will be talking about biological cleansing of ocular surface for collagen regeneration in keratoconus patients. No financial disclosure. So as we know that keratoconus is an inflammatory progressive...
Be louder.
As we...
Yeah.
Is this better? So as we already know that keratoconus is an inflammatory progressive corneal disease. So there are many modalities that have been done for halting the progression, and corneal cross-linking is one of the most commonly done methods. Many outcomes can be expected, including excessive corneal haze, corneal flattening, or continued progression can be seen. And scouring through literature, what we found was inflammatory markers like MMP9, IL6, and TNF alpha are involved in the inflammatory stress that is seen in keratoconus. So we found out that cyclosporin and trehalose, which acts at these respective places, being an mTOR inhibitor, number one, and trehalose being an inhibitor for FAGO4. This can be utilized in keratoconus to prevent the inflammatory status from increasing, as mentioned in the previous slide. So our research question was to find out if we can modulate this inflammatory stress to stabilize keratoconus. So we did an in vitro and an in vivo study. In an in vitro study, we used the human corneal epithelial cells, and with trehalose and with cyclosporin, we tried to find out if it modulates the stress that was seen. And using the lysosome tracker, we were able to finally come to a conclusion that these drugs, trehalose and cyclosporin, are able to reduce the inflammatory stress. So we also did an in vivo study where we chose 90 patients who were mild to moderate KC, and we divided them into two groups, which got a non-targeted therapy or a placebo therapy and a targeted biomarker therapy. So we used the biomarker kit, which is a proprietary tool which measures about 8 biomarkers. Amongst them, MMP9 and TNF alpha were the two markers that were mainly involved in keratoconus. And after finding out that those patients who had higher levels of MMP9 and TNF alpha, they were given targeted treatment, that is trehalose and cyclosporin. And reassessment was done at 8 months, both topography and epithelial mapping, MS39, and polarization sensitive OCT, which is a custom-made model that was done at our institute, was done to analyze if there's any progression of keratoconus. So in the patients which received group 1, that is non-targeted therapy, about 64% of the patients progressed compared to group 2, where only 12% progressed and 88% were found to be stable. And even the MMP9, TNF alpha, and IL6 levels on the second visit had drastically decreased, which was statistically significant. So even on topography, we found that there was flattening of the cone and pachymetry was stable. And we also had a custom-built PSOCT machine, that is polarization sensitive OCT, which measures in vivo collagen imaging, and it uses the principle of birefringence. And even on that, we found that the collagen was stable. So in conclusion, the innovation in our study was usage of simple drugs like trehalose and cyclosporin can be used to halt the progression of keratoconus at a molecular level that can be deemed as biological cleansing. Thank you.
There is good logic in what you say, but were these young patients who were analyzed or older patients who were anyway not going to progress in the keratoconus? That is a question.
Ma'am, we chose patients who were mild to moderate keratoconus, so we did not choose those who had advanced KC because they would inevitably require a surgical intervention.
Any particular strength of trehalose, and that's the number one question. Then second thing is, how long was the stability maintained?
Yes.
How many did you have to go in for subsequent procedures?
Yes. So we chose sodium hyaluronate 3% with trehalose 0.18%, cyclosporin of 0.09%, and it was instituted for a total of 6 months. And then we reassessed again. So that's sodium hyaluronate. So trehalose cannot be given individually, so we had to reconstitute it with sodium hyaluronate.
Thank you.
Thank you.
Well